My name is Sandra Nova. I am a pediatric nurse with the pediatric department. I also serve as the CenteringParenting coordinator. Centering Parenting is an opportunity for families and their providers to have a conversation around their children. Oftentimes in your normal visits, the provider is the expert and the parent comes in to hear their recommendations and guidelines. But Centering Parenting is actually a space where the parent is also an expert and they can share what's actually worked for them in raising their children. Oftentimes providers will tell you, for example, for your child to develop normally, these are the things you need to do. But it's a different thing when you go home and you actually try to put it into practice. So actually hearing from other parents how they actually manage to do that is really important.
Centering Parenting is a really innovative way of providing care to children in the first 2 years of life. Instead of doing the typical routine checkups for young children and newborn infants individually, we actually invite families to participate in a group that includes parents and the child who come together traditionally for visits at the same routine intervals, but where they can benefit from having a group interaction, socialization, as well as sharing ideas amongst the group instead of the traditional one-on-one family to provider model.
So I think everyone involved benefits from the program. So the parents and families benefit from having a support group. They have more time with their providers, which is something that the families really like. The providers themselves, we really like having more time with families in order to have more in-depth conversations and to really explore some of the questions that families have in a space that's much more than the typical 15-minute appointment.
I think it's beneficial for parents because they get that extra time, not only with their provider, but also with other parents, to learn that sometimes what they think is only happening to them, it's actually happening to others, and that it's okay. That there are solutions to some of those problems and questions. And also because I think a lot of our families are here alone. A lot of them are immigrant families that don't have the extended family support that you would normally. And so finding a support group in your centering cohort is, I think, helpful, and it helps to build a network not only for yourself as a parent, but also for your children as playmates as they grow and get to know each other. And also because they get to learn, again, like I said, from their providers, but also from other parents.
I'm involved in Centering Parenting because I'm very interested in innovative approaches to particularly pediatric preventive care. For many, many years, the model hasn't changed much, but I think there's a lot we know now about what parents and families can offer each other that really supplement the information that medical providers have to give to parents. And personally, I find it very rewarding because I often learn many things from the parents that are involved in Centering Parenting. And so it helps me stay fresh in terms of ideas. It also allows me to provide that preventive guidance in a format that I think is just more enjoyable for families. Traditionally, in a regular visit, we're often rushed for time, and so frequently the anticipatory or preventive guidance kind of gets pushed to the very end, whereas in centering it takes a front seat and it's the focus for a much longer and much more fruitful discussion.
I think the biggest change brought on by the pandemic has been a shift away from the in-person experience to a more virtual format, which has distanced our way of communication, but it also has shown through with the sense of resilience here, not only here at Ravenswood, but in the broader community as we join together and still carry out the Centering Parenting experience.
I think COVID has changed Centering Parenting quite a lot, actually. Rather than being together in the same physical space and seeing the kids interact, we have had to adapt to our environment. I'm and so everything is now virtual through Zoom. It's really nice that the parents can still connect with each other over video chatting, and we still get a nice dedicated chunk of time to answer families' questions, and that they get to connect to each other as well. But I do think that it is different. It is different.
Probably my favorite part of the sessions are the opening and closing activities. They're short, but honestly, people have remarkable candor, and they're very truthful, which I think is really rewarding and refreshing to see. And so with those just fun icebreaker or closing activities that we all do together as a group, you learn some really amazing insights into people's personalities and their families that it doesn't take a lot of time, but it offers a lot of reward. That's my favorite part.
Well, my favorite part is definitely seeing the babies grow up. You know, they come in barely able to roll, and then by the time they graduate, you know, they're jumping around and running uncontrollably. But also to see the bond within the group grow, that they know each other's kids, that they know each other, and that, you know, we know them a little bit more. As a family unit is not just the baby or the baby's mom, but like a whole family unit.
My favorite part of Centering Parenting is definitely the bonds that I get to see developing between families and patients, and then also myself getting to know the families better themselves. It is really a community.
If you're a parent of a newborn and are interested in joining Centering Parenting, just give us a call or reach out to a staff member here at Ravenswood Family Health Center.